This is when I start saying a lot, right?
Probably not. But you can if you want to.
Thanks for the permission.
All right, welcome everyone. We are joined by lots of good familiar faces, and we'll do some introductions in a second, but this is the community volunteer update on the happenings around COVID. And I'm David Lopez, Center for Humanitarian Engagement, and I'm just thrilled to have everyone here and talking about this. You're probably watching this afterwards, which is fine, no problem. But one of the things that happened last week is not COVID related, thankfully, but it's service related. And so I wanted to highlight that. We had our fall service day at Walla University, and there was just over 600 people involved in 40 different locations around town. And it couldn't have happened without the good partnerships that we have around town with all the good nonprofits, from the Disability Network to Hope Heals to Sunbridge and all across with Parks and Rec. Blue Zones Project, we had our marquee demo project, which was just a lot of fun. It's actually a bike lane down College Place, down 4th Street in College Place. And so there was just lots of good energy, lots of excitement and interest, again, about what's happening with COVID response and whatnot. So Nikki, it kind of ties back into our goal here for this conversation and for community health's goal is really wanting to make sure that we're working towards a safer, healthier, thriving community. And we're in this together. So I think that's a message that keeps resounding. And I'm just, thrilled to be part of anything that has such a strong standard here and high goals. So thank you for setting that. And this is kind of a real quick agenda of what we're hoping to cover. And we might skip around a little bit, but Nikki Sharp, I always forget your title, but it is person that does everything good. So maybe clarify what the actual title is and introduce yourself, Nikki.
So thank you very much. I think, community do-gooder, I think was another term. I think we can have one. I mean, my goal is just collaborator and connector. So, but my title actually is the Healthy Communities Division Manager here. And that's looking at a lot of things that are not clinic oriented necessarily, which is really thankful. I'm so thankful that we have Andrea here, who is another one of our team members. We're really thankful that she's on our team. But yeah, my role has been more about getting everyone together and also looking at that continuum of health that maybe not always is as tangible, but it's all there. It's all connected, just like you said. So so thank you for that introduction. And I do feel like I want to make sure we'll do a quick who everyone is, but we do have EMS involved, and that kind of segues right into what we're going to be talking about today. So thankfully we have some, I did not really know all the things that EMS did until we had, I think, of the flood that was happening before COVID. And so there was just a lot going on for these amazing humans and that help us make sure that we follow a structure, and that helps us be able to think clearly and follow and execute. So I'm going to real quick introduce Liz and Patrick, and then they can talk about why they're involved, and then we can talk about why are Amanda and Andrea here, and so who they are and what they do. So Patrick and Liz, would you be willing to just real quick give a kind of update on what you do and why this is so important and why you guys are essential to this?
I'll start, and then I'll ask Patrick to chime in if I've missed anything. Not to correct you, but we're EMD. EMS is no problem. It happens all the time, and we get their mail. So EMS is Emergency Medical Services, and we're Emergency Management Department. And no problem. It happens. I just wanted to say that we're involved because of the Washington State Emergency Worker Program. It provides liability coverage for property damage, bodily injury. I'm reading from the RCW, immunity and indemnification. And so that's covers if there's property damage for something that the person owns that gets damaged over the course of working at during an approved mission. It covers hospitalization that isn't covered by insurance for that individual. So there's a lot of good reasons to have folks registered as an emergency worker in that program. We background check each person, and then we enter them into a database that we maintain containing all of the different emergency workers. The RCW in question is RCW 3852, if anyone is interested in looking that up and finding out the particular information. The workers are only covered when they are working on an approved mission, which everything related to COVID is under a mission number that was given out by Washington State Emergency Management very early in this event. But if you're an emergency worker, that doesn't mean that you can volunteer or go someplace without are being aware of it and be covered. So we want to make sure people understand they need to be working with David Lopez and be working under an approved mission, and then they do have that coverage available to them. And they do have some responsibilities, pretty straightforward stuff, you know, no drugs or alcohol, just, you know, have to be working within the scope of the mission. So if you do something wild and crazy and you get injured, then that would not be covered. I can't think of anything related to administering vaccines and helping out with these clinics that would be outside of the scope, but it happens. And Patrick, is there anything that you'd like to add?
Not really. I think our job is just to help make sure that the volunteers get the safest and most rewarding experience that we can.
Perfect. Thank you.
And we appreciate you both and all the support that you give us. So thank you for always picking up the phone call and being present also in a lot of the clinics that we participated with already. So thank you, Liz, and thank you, Patrick.
You're quite welcome.
So yeah, thank you very much. Patrick, do you have anything to say?
No, I'm good. Thank you.
Okay, good. Just making sure if there's anything else you want to make sure you put in there. All right. Well, let's go back to our slideshow there, and then we can talk about what we've been doing, and then we'll go into what's coming. So like we said, we've been doing Vaccination Clinic at Southgate Tuesday through Saturday from 9 a.m. to 5 p.m. And that is done through our contracted group through DOH Aristo, and they have helped out with some of these mobile efforts that we've done as well, which has been really nice. As a lot of people have experienced like staffing shortages, and this has been a helpful opportunity for us to have additional support. But we see that's going to continue to be a need. We have 4 mobile vaccine clinics that we did with like long-term care / more of a residential living for individuals who are in that older population who have more higher risk conditions or struggles with mobility. So we've done those in the last week, and we have some homebound residents that we're working on scheduling this next week and continuing to work through mobile requests that come our way. Our priority is that we're looking towards, though, is in 2 weeks, we'll see the approval of pediatric vaccinations for the ages of 5 to 11. And that will be a specific, totally different dosage and of Pfizer, which will be the first approved one. And then we see Moderna as another one that will be approved as well. But we've been a primarily Pfizer community. So we'll see what options we have and what the interest level is. The guidance that we've seen has been like places where people are going to get vaccinated are probably going to be where they have trusted relationships. And so schools has been where we've primarily looked at our efforts, because the space that is required to do these and the ability for us to continue with the monitoring piece, as well as just the importance of trying to get the best access points for individuals who may not always have access to every single, time is one of those resources, as well as, parents have been working for a long time. We've had school. We don't want to have kids miss any more school than they've already missed. So our primary location where we'll be doing vaccinations will be at school, but that'll require parent consent and very likely their presence, because we're planning around hopefully finding ways to make sure that parents can be at those clinics, because we know kids will feel more comfortable with their parent present. We're also planning to do 1 day a week for pediatric clinics, just only peds, because we want to make sure we have parents have that. If they have more time and availability, maybe on a weekend, they can do that same thing and fit it into their schedule that way as well. So our goal is to help parents do the best that they can that want to get their kids vaccinated. There will probably be some initial kind of interest at first, and then it'll probably taper off. And so we'll do everything we can. We've ordered vaccine, and we will be hopefully it'll be arriving here in the next week or two, not week or two, next few days. And then we'll, as soon as the approval is ready, then we will go and we'll make sure we're starting those clinics and being thoughtful. So we're continuing to do testing throughout Walla Walla. We have Southgate is also our testing center. We are testing Monday through Friday from 8 until 2. And the reason for those timeframes is because the courier service, to ensure that we get 24-hour turnaround, has to happen at 2 p.m. And so that's why it's 8 to 2. So that'll be Monday through Friday. And that's helping our community reduce the testing burden that would be happening at the hospitals and some of our urgent care clinics. So those are less of that burden, so that they can focus on those people who need other medical help and attention. We are keeping updated on our, if you hopefully pay attention to our social media, we're seeing information about what the boosters are and what it means to get a booster, what it means to be looking at pediatric vaccinations. So we're trying to communicate where, when, how often, et cetera, so that there is communication coming out from our department. That'll be on the Facebook. It'll be on our website as well. So forecast upcoming volunteer opportunities. We have quite a few coming. And so we have a calendar that people can look at, but I'm also going to real quickly share my screen on this one, I think, David, so then I can show the times as well for everybody. So real quick, share my screen, and it'll also show our current needs. So what we're anticipating is some of these smaller, we have some tentative dates planned for our smaller communities, smaller school districts, and they'll probably have smaller need for volunteer. And then if you look here, starting on the 10th of November, we are looking at 3 clinics per day. So the 10th, the 12th, we have a holiday on the 11th, so that will not be a day we'll be doing vaccine clinics. So the 10th, the 12th, and then that next week we'll be doing some of our outskirts. So we also have the 9th as another option, because we're moving over from the 5th, because we thought we could do the 5th, but it just doesn't look like the right timing. So we'll go the 10th, 9th, 10th, 12th as our first 9 clinics. We have a need for 9 to 12 team members that are volunteers. We're looking at when the volunteer signups come up, we'll have 5 to 7 of those will be clinical, and then the rest will be a non-clinical registration assistance. Maybe it's mobility assist, maybe it's navigation. So it'll be clinical, non-clinical role. So that way we can ensure we have coverage for observation, vaccine table assistance, any of those additional like holds or writing. We have a new vaccine card we have to write on. So we'll make sure we have all those materials and have it go nice and smooth, so that young people, the shortest duration of time that they're sitting waiting for a shot, the better. So we are going to do everything we can to reduce that wait time. So that first week of November will be the 9th, 10th, and 12th, starting at looks like we have like a 9 o'clock. So that would start, hopefully everyone will be there at that'll be like our arrive time, and then we would get things going and then go for an hour and a half, deconstruct. So set up, takedown will take about a half hour on either end of these clinics. So that would be the 9th. So 9 to 10:30, take down everything, go to another clinic if you were signed up for 2. Otherwise, we'll have 2 clinics in an afternoon because elementary schools, parents come on campus oftentimes for these, and this is where we can capitalize on that access piece there if parents wanted their kids to have the vaccination with them present. So then after that, we have the next week, which would be the 16th, 17th, and 18th would be when we would be doing additional clinics there. These would be some of our outskirts community partners, and so places like Prescott would be our goal, Touchy, and then our Bernie location. So those, again, somewhat shorter clinic duration, but because we just know that there's smaller amount of humans that are going to school there. So, and then that would basically wrap up. So 2 weeks total of just like full on work. And then we'll have that Thanksgiving holiday, not doing vaccination clinics for peds. And then we would do the next clinic start time would be the 3rd of December. And we would make our way the 3rd, 6th, and then, well, that's January, sorry. The 3rd of December would be our next, our second dose clinic. So people who've already signed up for one, maybe they sign up for both, and then they've done the same group of people, and then they are more familiar faces. That's one of our strategies. What we're going to hopefully do is have people like our Providence partners, Walla Clinic, take some of those dates and then fill some of those clinical roles, and then we'll know what roles we need to fill as well with these once we build out these volunteer clinics.
Nikki, that was excellent. Tell me what's different. I'm a volunteer and I want to sign up to be the registration. Is there anything different working with kids? Or is it the same job I've done before?
Well, in the past, registration was that you met with that person and you asked them all these questions about whether or not they've had a allergy response or if they're allergic to certain things. And some of those registration questions are only appropriate to be talking to a parent. I know that I am not always the most reliable memory person, and these young people are ages 5 to 11, and so their parents need to be answering these questions and consenting for that. So there will be a difference in that we will not be making additional phone calls. We want everyone registered and make every effort to have a parent present to participate. So, some parents may give consent earlier, but we are going to do our best to have as many adults present as possible to help.
Perfect. Yeah. And the idea is that they're hopefully pre-registering the days before. Yeah. So you have an idea of flow and everything. Good. Mm-hmm. And then from a clinical perspective, is it any different? Is it a longer needle, shorter needle? Is it the same location? If I was clinical, I would probably know, but I'm just curious. Yeah, no, it is. I would probably ask my amazing person over here, Amanda, who might know more about what it looks like. I know it's a smaller dose, but maybe Amanda, do you feel like you could weigh in on that?
Yeah, so we'll definitely have similar size needles for most of the children because they'll be a similar size to most of our adults probably. But there will be small, instead of with the adults where we have larger needles available, we'll have smaller needles available for those that have teeny tiny little arms. So the vaccine should go in the same location as it does for adults. And so there shouldn't be any technique changes. And it is a smaller dose. So that is just one thing to notice, but it won't affect how the vaccine is given. Good question.
Thanks, Amanda.
Mm-hmm.
I think the one other thing I'd like to say is the clinical person, if you've worked in pediatrics, you may be familiar with sometimes parents or identified person who's been trained in the pediatric holds. There's some differences in how you would hold a young person who may need some additional support. Sure. So that is something that we are looking at as utilizing experts in this and ensuring, again, you have some help from a trusted adult or someone who is an approved adult to do so. So we want to be thoughtful about that.
Maybe this is for Amanda as well, but is there any additional, is there an observation period with this as well? Is it shorter? Is it longer? Do we need to recruit volunteers to have entertainment during that time, or what does that look like for the observation?
Observation is going to be really similar to an adult. Those same timeframes, 15 or 30 minutes, depending on, what other history the patient has. Entertainment wise, probably wouldn't be have something going on. These are younger kids that will be sitting there hopefully with their parents or trusted adult, and probably need something to think about of the fact that they just got a shot. So I think that's probably something we could talk about further.
Sure. Okay. Love it. Those are my questions.
Thank you for having questions. So thank you for being thank you for being willing to help volunteer. And we need your help, and once we build out these, we'll attach this video, hopefully with links to go and sign up for a clinic, and then we will have the ability to go out and do all the hard things, but making it a lot easier for Walla Walla.
Very good. Thank you, Nikki. Was there anything else you wanted to cover?
Not at this time. Please reach out if you have questions. You can call our office at 524-2650. I'd be happy to speak with you about any other ways for us to do this. So thank you so much.
All right. Thank you, everyone. And again, it's a partnership that makes it happen. So please reach out if you have any questions. We will continue to meet twice a month here, the 2nd and 4th. Is it Wednesday today already? Wow. In hopes of keeping you updated. And right now you've heard the current needs. We need volunteers that are willing to work with pediatric ages and to be able to mobilize and to go to these different schools. And it's a little bit different than coming to the fairgrounds. We've even at the last drive-through flu influenza, we had people still show up at the fairgrounds. That's how everybody's been programmed. But yeah, these will be on site in the different schools. And as you can see, it's a busy morning for some of these. There's 3 different locations. So we'll need lots of different volunteers to help. So thank you for being interested. Reach out, volunteerww.com, or you can always email me directly, volunteer@wallawalla.edu. So we'll keep you busy this season, it looks like. So, and that's just the first dose. We just talked about first clinic. There'll be a second dose as well. So so stay tuned for more. Thank you, Nikki, and thank you everyone for participating today. And we'll close this out for today and look forward to the exciting volunteer opportunity that you've provided for us. So thank you, Nikki and team.